Hello! Today we are diving into a topic that doesn't get talked about enough. Postpartum pelvic floor issues, leaking, prolapse, pelvic pain, and all of those things your friends might have failed to mention. I'm going to break down what's actually happening with your pelvic floor after birth and share my 5 OBGYN approved tips to help your recovery. If this is your first time to our channel, welcome. Please hit subscribe. I'm Sarah. I'm a board certified OBGYN and mom to 3, and my husband's a pediatrician. We share educational experience and evidence-based info about pregnancy, birth, postpartum, and parenting, all as we are living it ourselves with our 3 kids under 4. All right, welcome back. As I mentioned, this week we are diving into 2 things I am so passionate about, and that is the pelvic floor and postpartum recovery. I'm an OBGYN, but I was not even remotely prepared for the ride that is postpartum, and it is my goal to make sure that doesn't happen to you. I've had 3 pregnancies and 3 vaginal deliveries, and each recovery has been a little bit different and challenging in unique ways, which I will talk about in the in real life section at the end, so stay tuned. I also am going to share with you some key things to know about your pelvic floor, and then my 5 tips from an OBGYN who has treated incontinence, prolapse, and other issues related to your pelvic floor, as well as my in real life experience as a mom to 3 to help you recover better. Let's really quickly talk about the anatomy of the female pelvis and the muscles of your pelvic floor. It is often an overlooked group of muscles, but your pelvic floor is amazing. There are actually 28 muscles that attach directly to the pelvis. The pelvic floor not only helps you control your bowels and bladder, but it also supports your spine and pelvis, holds those internal organs in place, and contributes to sexual satisfaction. Problems with the pelvic floor often show up during pregnancy or after giving birth. These are problems such as incontinence, pelvic pain, organ prolapse, issues with sex, or back and hip pain. These problems or pelvic floor dysfunction can develop for a variety of reasons, including using those pelvic floor muscles too much, so those muscles that are tight and don't relax and then become weak as a result. It can happen because you're not using those pelvic floor muscles enough, so the muscles lack tone and are weak. The muscles can be injured, or the nerves in the pelvic floor can be injured, so perineal injury or nerve injury from birth, sports, accidents, surgeries, things like that. It can also come from poor posture and alignment. All of this to say, the pelvic floor is the foundation of your core and certainly is deserving of a lot more attention than it gets. Unfortunately, though, you often don't think about your pelvic floor until you are pregnant, and then maybe even not too much. But after your baby is born, or maybe during pregnancy, you will realize what a huge role it plays in so many aspects of your daily life. During pregnancy, urinary incontinence is reported, kind of depending on the study, from 7 to up to 60% of women. It is important to know that for most women with incontinence during pregnancy, symptoms are likely to resolve after delivery. 70% of women with onset of urinary incontinence during pregnancy experience spontaneous resolution of symptoms postpartum. By 12 months postpartum, the prevalence drops to between 10 and 20%. The good news is there is a lot that you can do to prevent and treat incontinence from pregnancy with pelvic muscle exercises. Ideally, you do this with a pelvic floor physical therapist before and after birth. Some studies have shown that pelvic floor muscle training, for example, Kegel exercises, may be performed on a daily basis to help reduce the risk of urinary incontinence. Some studies show that prenatal pelvic floor muscle therapy is associated with a 50% reduction in prenatal and a 35% reduction in postnatal urinary incontinence. This episode is sponsored by Attention Grace. Something I always recommend for postpartum recovery is to have a nice pad. As you go through postpartum sleep deprivation, bleeding, and leaking, you need a pad that is comfy and absorbs everything it needs to. Trust me, it is the little things that make all the difference in those early postpartum days. A lot of traditional bladder leak pads have a top sheet that is made from petroleum-based plastics and treated with chlorine, synthetic dyes, fragrance, and other harsh chemical irritants. And you can feel this. I have tried a variety of other brands and I really hate the plasticky, slippery feeling. As it turns out, those chemicals are not necessary for the products to perform. Lucky for us mamas, Attention Grace pads are, well, quite lovely. They were made to be gentle on your skin while keeping you dry. They give you all of the super absorbent protection you need with none of the chemicals you don't. These pads have a skin-safe, plant-based top layer that is incredibly soft and quick drying, and it has a powerful super absorbent core that locks in leaks where they belong. They are free from chlorine, dyes, fragrance, PFAS, and phthalates. This plant-based design from Attention Grace is truly lovely. Even better is that Attention Grace is now available in 200 plus Meijer stores across the country. So when you go or send your sweetie to go get some pads for you postpartum, look in the aisle for Attention Grace or use our code at their website, Bjorkman20, for 20% off at attentiongrace.com. As I mentioned earlier, nearly 1 in 3 women experience urinary incontinence postpartum, and around 1 in 10 report fecal incontinence. It is common, but it is not something you have to live with. So let's get into my 5 tips for healing your pelvic floor after baby. Number 1, start gentle pelvic floor exercises early. Think Kegels, but smarter. So during pregnancy is a great time to start focusing on your core and pelvic floor. And if you had an uncomplicated delivery, you can start gentle pelvic floor activations. Yes, like Kegels, as early as a few days postpartum. But here is the key. You want to focus on coordination, not just clenching. A pelvic floor physical therapist can help make sure you're engaging and releasing those muscles properly. And here I am going to link 2 great videos that really show the breath work that I like to do postpartum and during pregnancy. My number 2 tip, see a pelvic floor physical therapist. This is an amazing tool for recovery. You do not need to have a problem to see a physical therapist. It's like going to physical therapy after a sprained ankle or a busted knee. You are healing postpartum. A skilled pelvic floor physical therapist can assess your specific needs and tailor exercises to help with bladder control, core strength, and even painful sex. My 3rd tip is don't rush back into high impact exercise. I get it. You want to feel strong again. You want to get back to your workout routine, but jumping back into running or HIIT, high intensity interval training, too early can worsen pelvic floor symptoms. Start with low impact movement like walking or postpartum yoga. Work on that core breath we talked about and really engaging and activating your core. ACOG actually recommends waiting at least 12 weeks before returning to high-impact activities, and even then, ease in slowly with pelvic floor support. My 4th tip for you to focus on is self-care. You can check out my postpartum favorites video linked here, but essentials for postpartum recovery are a peri bottle, ice pads, a stool softener like Miralax, and nice absorbent pads. So straining on the toilet is a pelvic floor nightmare. That increased Valsalva is really hard on your pelvic floor, especially when you are healing. So you want to keep your bowels moving with lots of fluid, fiber, and stool softeners if needed. A peri bottle is great to help keep things clean without having to use toilet paper or a washcloth. Icing the perineum is really helpful, just like you would ice an injury, a sprained ankle, to ice that perineum. And a nice soft pad that is absorbent is really, really helpful. My 5th and final tip is that posture and core matter more than you think. Slouching, holding your breath while lifting, or gripping your abs can increase pressure on your pelvic floor. So focus on functional core engagement. Think about exhaling while lifting your baby or gently activating your deep core, that transverse abdominis, when you are standing or walking. So every postpartum recovery has been a little bit different. So I had 3 vaginal deliveries. With my first, I remember postpartum getting up out of bed to walk to the bathroom and just feeling like my pelvic floor was just being pulled on by gravity. It felt so heavy, and I'd stand up and be like, well, my vagina might fall out. This is bizarre to have this feeling. And so that was a very interesting feeling. With baby number 1, I really, a couple days postpartum, would start working on that core breath. I had an ab wrap to help with a little bit of support that I'd wear for a couple hours a day, not a long time, and really focused on core breath, activation of my core, and things like that. I'd go for walks outside when the weather was okay, short walks, and really also eased back into exercise. I did not exercise enough in my first pregnancy and really had a lot of pelvic girdle pain at the end. Like, it hurt to walk upstairs or put my shoes on. So second pregnancy did a lot better and worked much harder at maintaining my lifting resistance training exercise. And that made a tremendous difference. Had another vaginal delivery, and that was less eventful, I think, largely because I knew what to expect. I knew the things I liked. I knew, hey, you're going to work on your core breath. You know the kind of pads you like. Here's what we do at the peri bottle. Here's your ice pads. It's a familiar season. You're like, okay, well, usually the bleeding is starting to slow down around 2 weeks. You just have these landmarks. You know the path that second time around, which is always helpful for me when I know what to expect. Eased back into lifting again. I really do not do anything really intense where I'm doing a lot of Valsalva, extra pressure on that pelvic floor. And I also really like and did Meg Squats +1 program. It's for prenatal and postnatal, like returned lifting and return to lifting. And it's very lovely. It's wonderful graduated return to lifting postpartum. Highly recommend if you're looking for a program to do. Baby number 3 was a little different. My Hank was way bigger than my other 2 kids. And the thing that was different with this recovery was I remember walking to the bathroom and thinking, am I bleeding a lot or am I peeing? I'm confused about what is happening right now. And turns out I was leaking urine. If I would let my bladder get too full, I would go to the bathroom and not make it. And that was really unnerving because it had never happened before. And I was just like, oh dear, oh dear. So that resolved after about 2 weeks. But when it was happening, I said, oh, I really need to focus on my core breath, on rehabbing my pelvic floor, on strengthening my core. And so that was one exciting thing for baby number 3. So know that your recoveries may look different every time. Hopefully these things help you recover better and know that you can get back to where you were before. If you are experiencing leaking, pain, all these different things, you can improve it. Remember, the postpartum period is incredibly challenging, physically and emotionally. You just did something incredible, even if you don't feel like it in the moment. So give your body time and the tools it needs to recover. And if something doesn't feel right, like you're leaking, having heaviness or pain, speak up, talk to your OBGYN, see a pelvic floor physical therapist, and hang in there. It took you 9 months to get here. Give yourself that time to gently get back to the strength you had before. Mamas, if you have any tips, things that helped you, products you liked, please leave them in the comments below. We will see you next week.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.